I'm Dr. Thomson. I focus on clinically supported lifestyle correction for treating chronic lifestyle diseases. Here I would like to share my professional experience with this approach. This series is about my experience with patients who took clinically supported lifestyle correction to avoid surgery and reduce and stop medication. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on surgical procedures or continuing with the lifelong medication. Here we learn of the approach for a patient, 57-year-old man, suffering from severe urinary pain and urinary obstruction. His ultrasound examination shows prostatic hyperplasia and cystitis, and he is having renal stone on the left side, and his right kidney is absent, and actually it is removed in 19 years back for renal stone, so he has only one kidney. Now his PSA is very high and suspecting prostate cancer, and he is advised to undergo surgery. He is diabetic for the last 18 years, and he is having arthritis and spinal disc prolapse also, and his radiculopathy, that is the referred pain to the left leg also. Here I will try to explain how the surgery could be avoided, how long it took for multiple medications to be reduced and stopped, how long it took to get relief from symptoms and progress evaluation based on corresponding improvements in periodic test. When we come to the patient details, it's a 57-year-old male, 167 centimeters height, and his weight is 52 kg only, and he's not overweight or anything. His abdominal circumference 80 centimeters. Not that abdominal fat is there, but slightly his fat percentage is 28.2. So even though he looked trim, but it's slight abdomen is there, protruding abdomen is there. Then when his details is his diabetes for the 18 years, and his right kidney is removed 19 years back for renal stone. Now the problem is severe pain and urinary obstruction, and the PSA, that is prostate specific antigen, it's a marker for the cancer, and that is increased, and naturally that is next is advised surgery and biopsy usually, or different way people manage. According to the doctor's preference, there can be different way of management is right. And there is a renal stone in the left kidney, only one kidney, and in that there is a stone also. And he is suffering from arthritis and this disc prolapse and radiculopathy, that is pain referred to the left leg also. So when we can categorize the disease as a metabolic syndrome, diabetes is there, and also cancer is suspected. So when we look into his, actually he's from North, he's a Malayali, but he's staying in North India. And initially he called me over the telemedicine consultation is taken, because he said he's in pain. I told him to show some doctors there and get some medicine. Maybe he's having, there are medications to relieve pain, and most probably he may be having an infection. Get rid of that, then stabilize and come down, because he has to travel also. But within 2 days itself he got a flight and come over, because he's consulted a doctor. The doctor said immediately he has to undergo surgery. He has not given any medication. So with that suffering with that pain itself, he came down, and he was telling me he is controlling the pain because he is avoiding taking water. For the last 3 days, it took 3 days or so, and he to come over. Anyway, he was in real pain and difficulty in urination, tiredness, and also he's having numbness, that leg problem is there, radiculopathy, and that neuropathy is there, and breathing difficulty, maybe because of all this severe pain and breathing difficulty is there. And actually he was not taking, even though if he's diabetic, he's not taking any medicine. He's afraid of taking medicine because he's only having one kidney is there, so he's worried. So he was very reluctant to take medicine. but he's not overweight or anything. He's managing his food and all is correctly. And his HbA1c was 7.5 and insulin level was high, that is 28.24. That means it is type 2 diabetes only. And RBS, his sugar level was high, 290. And his lipase level, that is a inflammatory marker of the pancreas, was high. That is very common with the diabetic patients, type 2 diabetes patients, lipase and amylase level. It's only for him, it is only lipase level was high. And HSCRP, CRP, ESR, all the inflammatory markers was high, and the blood count, WBC count, neutrophil was so high, and hemoglobin is low. So blood parameters all is on the wrong side, or it is showing high inflammation or infection, and iron level was low. Microalbumin, urine protein and microalbumin was high. Sodium level was low, and chloride level also is low, because his all the this diabetes and glucosuria and so many problems is there. Maybe because of the sodium and the electrolyte imbalance is there, and vitamin D is very low, 6.5 only, and urine glucose, this puzzles, sugar, protein, RBCs, blood is also in the urine actually. And everything is positive, and PSA level is 25.46. And usually when I don't advise patients for going for biopsy and all when it is they are suspecting a cancer. Usually we go directly to, if it is sufficiently high tumor markers, it's always better to go for a PET scan itself, because we will get a very clear idea. But this patient, we didn't ask for a PET scan because he's having pain and urinary problem. He's not in a fit position to go for a scanning itself. So what we decided is we'll wait and see whether the PETs we can, for as in the clinically supported lifestyle correction, for the those patients with the PSA high also comes, and their PSA value will go down. We usually check within every 8th day when they come out. Every time we check the PSA, and PSA will come down. Even those who are proved with the biopsy, PET scan, and even with the PET scan, there is cancerous growth is there. Even there are after if it is spread is there, there is not much use in doing a prostatectomy also. So there will only chemotherapy and radiation and such things are there. Such patients also, they get relief. The PSA level will come down. That PSA level comes down means there is progression is stopping, or we are in the regressing phase. Then no need to worry. For this patient, because of his health condition, we didn't ask for a PET scan itself. Then Then we will see what was the result actually. So for this patient, we decided to get him stabilized and see whether the PSA is coming down. Then we can decide in a later stage, within 1 or 2 weeks, we can decide for the PET scan. That was this thing. And for him, the ultrasound scan showed only one kidney, and also there's a 6 millimeter sized stone. The first kidney was removed, his right kidney was removed because of the stone. Now the second kidney also having a stone, but it is small, 6 millimeter only. And the enlarged prostate, that is 55 gram, and the hypertrophied bladder mucosa, that is cystitis also. Bladder mucosa also hypertrophied, maybe because of this obstruction or because of this infection. And the residual urine, which is around 300 ml of residual urine is there. So that means there is a urinary retention is there. Then when we come to his body parameters, he is not normal body weight, only 52 kg, and BMI is in the low normal range, only 18.9. That is why he is maintaining that without his diabetic, you know that he is diabetic, and he is maintaining in a correct parameters. That is why he is managing without the medication for the diabetes. And abdominal circum is slightly high, 80 centimeters is there. BP is okay, and the fat percentage is 28.2. That is high. So the insulin resistance is there. Then this sort of patient, it is season pain. How we will manage this patient? So we generally don't take, when the clinically supported intervention is only, lifestyle correction is only for the chronic diseases, not in any acute stage. But this patient, because he came from far off place and he need pain relief, so his infection is the urinary infection. That is one of the reason for the pain. So we put him on an antibiotic, and also this pain, urinary pain, specific medications are there, that also given along with the clinically supported lifestyle correction. We are giving him for this pain and the infection also, specific antibiotic. Actually, because of his discomfort, he didn't want to travel. He was staying in the nearby hotel. And the next day itself, we checked his urine, because we wanted to see that his sugar and urine level is coming down. So next day itself, actually, his urinary problem as sugar and all came down, but leukocyte and all was there slightly. But the next day morning itself, he's very much relieved of the symptom actually. That is usually we see the patient only on the 8th day, but for him, because he was next day itself, he is comfortable, and the sugar level came down. It was only the morning, next day morning, it is only 120. It was when started, it was 290. It has come down to 120. How that fast result, how it is attained? That is actually, we are giving a low calorie diet. That is carbohydrate, because we are suspecting cancer for him. So no carb diet actually. No carb means the body, for the nervous system functioning, you need around 50 grams of carbohydrate. That is 50 grams of glucose a day. To maintain that level, use the carb. Otherwise, only special food should ensure that we are giving special food to ensure all the nutrition is getting. And also extra, because he doesn't need any weight reduction actually, only fat reduction is needed. He can take some high protein diet, especially when we are suspecting cancer. It's always better non-veg items, because that doesn't contain any carb. But it is very difficult for the vegetarian, because to get a carbo-free vegetarian food. So he's a non-vegetarian, and he can take some fish or meat and some leafy vegetables also. And otherwise also all the nutrients are given from, and in the support food itself it is there, and he can take additionally that. And in the 8th day itself, what was the result with this? As I said, the 2nd day itself, the pain is reduced, blood sugar is normal, and when we without medication itself, HbA1c came down to 7.4 in the 8th day, 7.2 in the 15th day, and by 30th day 6.3. And by day 60, it is 5.9. So HbA1c also come down. Always he's keeping his blood sugar level around 100 only, even after food. So that is very important for this patient, because we are suspecting cancer. So it is not just diabetes alone. So diabetes, we are not that strict about the carbohydrate consumption. Once in a week they can have enough of carb also, but not for the cancer patient, especially when the tumor markers is high. Only after tumor markers is down and the PET scan is needed, if it is, that also shows relief, only we can add the carbohydrate in the food. So why it is so? The cancer cells needs glucose for their energy and also for the multiplication. So if you cut the carbohydrate itself, you are actually starving the cancer cells. That is applicable for all the cancers, whether it is stage 1, stage 2, stage 4, whatever way. If you are able to starve the cancer cell by cutting the glucose content in the food, and also in meantime you should, that alone is sufficient, make sure that you give all the nutrient in the correct proportion for the building up of the body. That is the repair of the body. That is, cancer occurs only because of the damages or the mutations in the cell. If you are able to remove all the mutated cell by you support your immune system with nutrients and new cells to produce new cells, and they will do the surgery. You don't have to go for any surgical procedure. Our own immune system has the capacity to remove all this. You don't need even robotic surgery. Robotic surgery is so common, especially this sort of prostate patients. Robotic surgery is used very commonly. So you don't need any robot or anything. Your immune system, if you are empower the immune system, they will remove and starve the cancer cells. That is sufficient for the generally. And for this patient, and this blood sugar came down, and lipase, that is pancreas inflammation, that is also by 30 days it was this almost the same, but by 60 days it came down to normal. HSCRP came down by 15th day, and CRP, all the inflammatory parameters, the blood count came by 15th day itself. It is all inflammatory parameters are all corrected by this thing, and the iron level corrected by 60th day, it was come down up to 113. And microalbumin, urinary protein was there, that is kidney was affected. That is very common with the infection, and also with the diabetic patients. That also could correct it. With the 8th day itself, microalbumin disappeared. The electrolyte correction within 8th day itself, electrolyte get corrected. Urinary infection cleared by the 8th day. PSA came down. That is the most important thing. PSA was 25.46, came down to 14.87 in the 8th day. And by 10th day, by 15th day, 10.58. And so it is coming down. So we decided not to go for a PET scan immediately. So by the 30th day, PSA is normal, 3.97. And again on the 60th day, it came down, further down, it's in the normal range otherwise also, 2.56. So we didn't go for a PET scan. There's no need for a PET scan, because only because PSA we are worried. Now the PSA is normal, then we don't have to worry about it. So he wanted to avoid a surgery, because he's worried of the surgery, and he knows that he's already diabetic and so many problems. So he wanted to avoid the surgery. That's why he came down with all the difficulties, with the suffering 3 days pain. He came down to Cochin actually, and it was worked, because he's by 58th day itself, next day itself he can see the difference in him, and he was so confident. And actually he stayed till 30th day in Kerala, not in the hospital or anything. He stayed with the relatives for 1 month, and then only after PSA is negative only he gone. And his HbA1c also by the time came down to 6.3. He is symptom free, and even his neuropathy, pain and all, that is disc problems were also relieved. Some numbness and all was there, but he is comfortable. By 60th day, it changed, some tiredness is there, otherwise he is perfectly all right. And that is actually the tiredness because of their family problem. He was running around and all by the 60th day. Otherwise he was doing fine. All the blood parameters normal. Next, what he has to take care of in the future. What is actually we are planning for him is actually, he is only 52 kg. He can actually by 60th day he increased 1 kg. Usually diabetic patient and all, we ask them to reduce the weight, but he has actually increased the weight. But his body fat level was 28.2 initially, but 60th day it came down to 20.4. That means his insulin is acting, insulin resistance is getting relieved, and his insulin is acting in the better way. That is why he is getting this HbA1c and all is coming down, the sugar is normal. And abdominal circumference also. And he's 80 centimeter, by the he's reduced to 78 actually by 60th day. But ideally he can bring his weight up to 55, but his abdominal circumference should come down to around 70. And when he is starting, his body age was shown below actually 41 only. But by 60th day his body age came down again to 37. So the body age and the health is actually proportionate to your bone and muscle health. When you are looking into for our diagnostic parameters, when we look, and your fat level should be in the low normal. That is for the men around 7 to 15 should be the fat level, and he is also advised to bring down his fat level to 15%. And definitely he should check his this PSA. HbA1c he has to come down, bring it down because he is suspected of a cancer. It is always better to bring down the HbA1c below 5. That is what we are advising for the cancer patients. The HbA1c has to bring down below 5 without medicine, not with insulin injection or any other medication. With the lifestyle correction, if the patient is able to bring down the HbA1c below 5, their cancer most probably we can come out of the cancer, whatever the stage. But how fast you are able to do it, that is the most important, because if it is in the late stage of cancer and how fast you are able to bring down will be the the SbA1C also, and also definitely the cancer markers, if it is, depends on the cancer C or C125 or PSA, that also has to, that is, so you can actually depend on lifestyle modulation for the cancer treatment also. That is actually, this patient's history gives that confidence to. There are other patients also with high cancer markers and also biopsy proven. The things also get relief. Only thing they should be willing for the correction. They should be willing for the change. Then you don't have to go for this surgeries, which are all having so many side effects. And also the chemotherapy, again, so much of side effect. And no guarantee also for the surgery or chemotherapy. Doesn't give any guarantee for cancer cure. So definitely when there are enough measures to monitor whether you are getting relief, you can definitely go for a lifestyle modulation. That is, this patient itself is free of this medication and all the biopsy, surgery, even PET scan you are able to avoid. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, and cancer come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of surgeries can be avoided. In the case of any lifestyle disease, the best treatment begins with the first step of diagnosing the underlying fault in lifestyle that is the cause of the disease. Next is corrective measures to rectify the damage and overcome both the disease and the need for continued medications and surgical interventions. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication or surgery that created the disease in the first place. This is why once medication is started, it becomes a partner of the disease for life. Very often, both the disease and medicines will keep on adding more numbers along with the unwanted side effects, with no hope to return to a healthy status, which not only affects the patient but also the dependents and caretakers. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed Diploma and MD in Obstetrics and Gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Center, Thevara, Kochi. I focus on lifestyle modulation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, their treatments with emphasis to the benefits of lifestyle correction from website and YouTube playlists. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding symptoms, current diagnostic methods and treatments along with the benefits and side effects practical aspect of lifestyle self-correction, and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical, and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. I would like to bring to your attention how the major part of the medications we take are excreted in urine, sweat, and stool. It will reach the groundwater, rivers, drinking water, plants, animals, and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases, and come out of medications. To protect your children, grandchildren, and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. Thank you.